When I was in training, I was attracted to the science behind it. I found it intellectually very challenging, all the changes that are going on in the field. But I have to say, when I was a resident, I took care of a variety of patients with different illnesses. And I have to say that patients with cancer were the ones that really touched my heart. To see their strength in the way that they face such a life-threatening disease was very inspiring to me. And when I was in the midst of making that decision, which was a process, actually my father was diagnosed with colon cancer. And I think that strengthened my decision to go into the oncology field. This is an ever-changing field. Every day we have new treatment options, and you know, I find that when I have a patient that has a new diagnosis of cancer and I come as a doctor and tell them and discuss the diagnosis and the treatment options, I see many times people think like, oh my God, I'm gonna be on chemotherapy and I'm gonna be really sick from it. Well, that's no longer the case. We have the older approach of chemotherapy for all patients no longer exists. We have nowadays we can personalize treatment for many patients.
Of course, when you hear the word cancer, you emotionally become paralyzed. But when I met Dr. Veliz, and I think I was one of her very first patients, she made me feel, I guess, as much at ease as you possibly can in that situation. She gave me a hug, and she was, I think the explanations that she gave me about my prognosis and the medical plan that she had for me, she didn't use a lot of big medical terms. She made sure that I understood exactly what what the plan was for me. Dr. Veliz repeated several things, which I really appreciated, because you know, you are mentally paralyzed, and she just kept saying that she was very pleased with the plan that she had developed, and that after 4 sessions of chemo, she told me that I would have radiation, and somehow or other I left that office with kind of a lighter heart and a lot of less anxiety than when I went in.
I love what I do every day. I think that certainly the science behind it is is fascinating, but taking care of patients with cancer, it's just very rewarding. Just to help them, you know, along the way, and to me, it's an honor to be part of their care when they are just battling the battle of their life. They're fighting for their life. They certainly want to keep a quality of life, but they want to live longer. And I think, to me as a doctor, being part of their team of doctors is very rewarding, and it's certainly an honor.